actually, I don't know why I'm not able to see the chat, but
I'll be monitoring the chat for you.
Okay, so one of the things actually I wanted to know is what level most people are at, and I tailored this talk mostly to like step one level. But depending on how well we are moving or how well people are answering, I have a few questions at the end which are a little bit maybe CK. I found it challenging to add some of the drug questions because they were really long. You know, I wanted to add some few drug questions, but they were kind of long. But hopefully, if we get to that, maybe I can organize another session for those who are doing a little bit higher level of biostats. So we shall start here with our first question. I think I put in my previous slide that one of the things you need to know how to do is like 2x2 tables, sensitivity, specificity, NPV, PPV, that's negative predictive value, positive predictive value, and so on and so forth. So we shall just go right ahead and start with our first question. And I think what I shall do is give you guys, because in the real exam for this kind of questions, you will have, I think it's roughly like 90 seconds, right? 1.5 minutes.
Yes.
So I'll just, maybe give guys just 1.5 minutes to answer a question and then show the, we were not able to do the poll. So Judy, you can tell me what roughly people are saying on the chat and then we can take it from there.
Okay. Right now, there's nothing on the chat. So hopefully people are just refreshing. But usually, we're not reading the question right now. So you should read it, answer it.
Yeah, read it, answer it, and then we can take it from there.
I'm reading it too, because this, okay. So, move the yeah.
Okay. Oh, sorry. I forget that.
So a couple of answers.
Sorry.
E. Hello?
Yeah, I can hear you. Sorry, I moved the next slide by mistake.
Yeah, so a couple of answers, E.
E.
Mm-hmm.
Okay, so I think that's wonderful. So for those who said E, I think you got the answer correct. So when you're looking at prevalence of a disease, you're looking at all cases, right? The numerator is all cases, and then the denominator is the entire population. So you're looking at all cases in terms of like, if you're looking here in this 2x2, you're looking at those who are disease positive over the total population, which would be W and Y added here and X and Z added at the bottom here. So W and Y total, X and Z total. So it looks like this is a basic principle that most people understand. If anybody really, because I'll tend to move on. If anybody has any questions, you can put in the chat box and we can take it from there. Okay, so we have another question here, and I'll give you guys a minute or so to answer. As I said, some of this will probably be straightforward.
These are hard.
These are hard?
Maybe it's because I haven't done it. So okay, so Doreen says we can't see the entire question. I'm able to see the entire question, Doreen.
So I don't know how you get it. Is that better, Doreen?
Yes. Okay, so no answers yet.
Come on, guys. Yeah, the exam, this clock will be ticking. Although
Sorry,
Again.
anonymous said C,
Uh-huh.
but
That's
that's
just
one
one
person.
person.
Yeah, just one person. Okay, we have so C. Those are two people. We'll wait till we have around five or so answers. D.
D. Okay. So two people said C.
Yeah, two people said C. Okay, we have three people who said C. Two people who said D. D, B. There's a B now.
Mm-hmm.
So most people, there's actually a masese on the phone call too. I thought you're
I know
related, but
Rita.
oh, okay. But I was like, oh, you invited your whole family. No, I'm making fun of you. So we have one D, one B. We have two Ds, one B, and most answers are C.
Most answers are C.
Yeah.
So clearly, this is one I guess we need to spend a little bit of time on, because the correct answer is actually D. Okay.
Guys, I
And
also failed. I would have said B. Okay.
so the question here is asking about incidence, and incidence is, the new cases. You're looking at new cases of a particular duration, and the denominator is only the people who are at risk. Okay, so people already who have been infected with that virus do not count as the denominator. So in this case, you're looking at 10,000 IV drug users in town A. So this is the baseline. You're starting with 10,000, but already 1,000 are infected. So if you take out 1,000 from 10,000, you're left with 9,000. And then they tell you during the 1 year follow-up, 100 patients develop hepatitis C and 100 die. Okay, so the number here should be 100 over the number that you started out with, right? Which was 9,000. Does that make sense? Because the 100 who die were already not part of the 9,000 pool. They were part of the 1,000 pool who turned out to be infected. So it's kind of hard.
That makes, yeah, I think that
it's
makes
kind of
sense.
hard because I don't see your faces.
Now, people are usually pretty, I mean, if something is not clear, people will ask for it to be explained again. So don't worry about it. Yeah, I just have to make sure that I'm watching the chat. But guys, does this make sense? Yes, and Kima says it's clear. And that's
It's
good,
clear.
right? So Irene also says it's clear. And I think these are the essence, right? Several, okay. So someone says, please repeat about the 9,000. And guys, this is about gamesmanship, right? That you should catch the annual incidence and then
yes, you're looking at the annual incidence, and your incidence, the denominator usually is those who are at risk of acquiring that infection. And so at the beginning, if you begin like with 10,000 people, but when you're screening them, you realize that 1,000 already have the infection. So these 1,000 are not at risk anymore, right?
Mm-hmm.
So you take them out of the pool. They already have hepatitis. So you're beginning with those who do not have the infection at baseline.
Mm-hmm.
Okay. And
so,
then I have a slide in the, I think, next few slides. For some diseases, like some diseases, you acquire hepatitis C, it's not going to go away. You can get treated, but, the idea is that with hep C, it's a chronic infection, like you're being monitored for life, just like HIV, you can have undetectable viral load, but you still have it in the background. But there are other diseases like malaria. Okay, you can go in and out of the at-risk pool because you get malaria, you get treated. So at one point you could be out of the pool because you have the disease, but then you can come back into the pool. I mean, you can get out of the pool when you get treated, but you can come back into the pool again once you get the infection.
Okay, so a few comments. The people who say, please repeat or you're not understanding, is it clear? Okay, Grace, let me change this a little bit and see if I can. Okay, so guys, I've offered you a chance to unmute. So Grace, you can go ahead and maybe talk and ask the question if that's possible. Hopefully it's gonna work. But a few people are saying yes, but then the question is, if we were asked period prevalence for that 1 year, what would be the answer?
If you asked about prevalence.
Yeah, period prevalence, yes.
Period prevalence.
Yeah.
So I guess it will depend. If you're doing, like, for example, at the baseline, this would be 1,000 over 10,000.
Okay. And then during the year, then would it
so
be
during
11?
the year, depending on, like, you know, because they said 100 people acquire hepatitis C. So during the year, I guess depending, if you take, for example, mid-year, if by mid-year, I'm just giving an example, 50 people have acquired, so at that point, then you will have 1,000 plus the 50 over the 10,000.
Okay. Okay. Some high yield facts there, and we can move on to the next question. Please do not get confused, but luckily we are recording this. Hopefully it's going to be successful, so you can rewatch.
Okay. Next question here. And if people want me to read the question, actually, I can do that as well.
You can.
Okay. A city has a population of 250,000. Of these, 10,000 of them have disease X, which is incurable. There are 1,000 cases and 400 deaths each year from this disease. There are 2,500 deaths per year from all causes. The prevalence of this disease is given by.
Doc, I don't know, as people answer this question, I don't know if you have plans to talk about the prevalence. Okay, we're talking about prevalence because Pauline has a question, so I'll ask it at that point.
Okay, yeah. So this question is about the prevalence.
Okay, Doc, so we have a couple of answers from here. We have E and C's. So E's and C's.
So mostly which one, E's or C?
Actually 50-50, E's and C's. Okay, we're getting a few more E's. So we have 1, 2, 3, 4, 5, 6 E's, and multiple E's now. Clearly E is the winner.
Yeah, so I guess that makes me happy because I feel like then we have the concept, because that's the correct answer, which is E, 10,000 out of 250,000. Sometimes they phrase these questions this way and it can get confusing, but prevalence tends to be, you know, at one given point in time. And so in this case, the correct answer would be those 10,000 who have disease X, which is incurable. So they're not moving in and out of the pool of this particular disease out of the total population, which is 250,000. If we had been asked about the incidence, again, looking at this question, the answer would have been taking the full population, which is 250, minus the 10,000 who have the disease, and then using the numerator would be 1,000 divided by 250 minus the 10,000. Does that make sense?
Okay, guys, is that clear? And could people try and just unmute themselves and ask questions? We should try that now. Victor, I know you're on. Could you try?
Sorry, did he ask a question?
Oh, no, I was trying to have people ask their own questions by unmuting themselves, but I guess no one is able to do so still. So I think people are saying that that's clear, okay. But the incidence explanation is not clear. So I guess we have to go back there again.
So I was saying for this particular question, if you were to look at the incidence, then the incidence, which is the new cases, would be the 1,000 given here. But the people at risk in this population is, you would have to get the 250,000, take away the 10,000 who already have the disease. Okay, so that would be your denominator. So it would be 1,000 divided by 250,000 minus 10,000, which is very similar to what we had before in this question.
I think we should move to the next one.
Okay. So here is another question. Sorry, just give me a second. Sweetie, you guys are so loud. You guys are loud. Sorry, I'm trying to sort out the kids.
No, this is a village initiative. As you can hear, I also have some background. But we have one answer for this, A. So 2 A's, 1 B. Okay. A, 3 A's now. A, D. So I'd say disproportionately more A's.
More A's.
Quite,
okay.
Yeah, lots of A's coming in.
Yeah, and that's exactly the correct answer, because they're looking, this question says here, there were no new cases of Ebola virus in the United States from January 1st, 1997 through January 1st, 1998. So they've given you the term new cases, because that's what incidence mostly looks at, you know, new cases over a particular time period. And, you know, if there've been no cases, you know, that means at the baseline, there were no people infected. At the end, no people infected. So all these people were at risk, but nobody acquired the infection. So A is the correct answer.
Could you speak about D and E?
B and E.
What's point period prevalence and what's point prevalence? Because it actually came up on one of the questions. Yeah.
So period prevalence would be, I mean, like looking at the same period, like from January to the end of the year, from January 1st, 1997 to the end of January, to the end of, I guess, 1997, which would be December, or maybe to 1st January 1998. So you have a full 1 year, right? So if you're looking at the period prevalence, you would get people who had the infection at the beginning of the year, then add in all the people who acquired the infection during the year, okay? Then at that point in January 1st, 1998, you're adding up the ones who had at the beginning, the ones who acquired the infection over the entire population. That is the period prevalence, okay? But at point prevalence, you can pick, for example, and say midpoint, maybe in between the year, I guess that would be like June 30th or something like that. At that time, how many people had the infection? So in that case, it will be the people who had at the beginning, right? They were infected at the beginning, and then the people who acquired in that 6 months. So at the midpoint of the year, you have at the beginning plus the 6 months, those who acquired over the total population. So point prevalence is at one point in time. Period prevalence, as it says, is given a time period. Make sense?
Yes, thumbs up on chat. And you'll get to see the chat after the call. I'm
It's
sorry, but
okay.
yeah.
It's okay.
Yeah.
So we'll move on to the next question. Oh, sorry. So I put in a few slides actually with each section just to maybe expound on this concept a little bit. So incidence looks at the number of new cases in a certain time period. And the denominator is always the population that is at risk. So you always have to exclude those people who already have the disease because they are no longer at risk during that same time period. Okay, so it looks at new cases occurring during a time period. And then when you look at prevalence, it's the number of cases, existing cases over the population at risk. Okay, and it looks at all the current cases. I guess I won't belabor the point. This is the slide I was talking about, moving in and out of the prevalent population pool. So if you begin with this person here who's at risk, they don't have the infection, then they acquire the infection, then they move into the prevalent population. So to move out of the prevalent population, you either recover or you die. Okay. And people who recover, then you do go back to the population at risk. But for some diseases like HIV, there's no recovering because you continue having the virus. And that's why with time, when we talk about the relationship between prevalence, incidence, and duration, the longer you have a certain disease, the
I guess
higher the
this is.
prevalence will be. Okay. I hope that makes sense. The
So
longer you
there's
have
a question here. If they die, does that affect the denominator of prevalence? If they die, does it affect the denominator of prevalence?
It doesn't, because usually we put like the entire population is usually the denominator in terms of the prevalence. So if they died, they already had the infection, they were part of the denominator and part of the numerator and the denominator, sorry. They were part of both.
Okay, I think people are saying they're getting you.
Okay, all right. And then I added just another slide here, just to clarify the point. Incidence is the probability of developing disease, whereas the prevalence is the probability of already having the disease. Okay. Numerator here counts in incidence, counts only the new cases. Numerator counts both the new and old cases in terms of prevalence. Okay. With incidence, you have to follow up the population to identify the new cases. Prevalence, you don't have to do any follow-up. It's because usually it's at time point. It's at the beginning, it's at the end. But if you're doing a period prevalence, then I guess you have to count all those people who acquired during a particular period. And then incidence is not affected by the duration of illness. And I think I had alluded to this point about the relationship between prevalence and duration of disease. So if you have a long duration for a disease, then it tends to increase your prevalence. Okay. And then incidence is the preferred measure when you're looking at cause and effect. So when usually we talk about causal association, it's usually inferred from the incidence and not the prevalence. Whereas the prevalence, is measured when estimating the population burden of a chronic disease, or when you say, number of lung cancer, for example, is attributable to smoking. Okay, I'll move on to the next slide. I put in this here, and I think we'll look at a few questions which have like, this, I'm sorry, it's a little bit blurry, but a few questions that look on the study designs. But typically you can measure incidence in a cohort study because you are looking at people who've been exposed to a particular exposure and then following them over time to see if they acquire the outcome. And so you can actually look at the new cases like of whatever outcome you're looking at. So you're looking at the incidence. Whereas prevalence is more with cross-sectional studies. Okay. And I will not
Okay.
belabor that point. I have another question here. Let's see if these concepts are sinking in. So the following graph represents the vaccination rate dynamics for hepatitis B in IV drug users in Town A. Which of the following hepatitis B statistics is most likely to be affected by the reported data? So you're looking here at this graph. I hope you can see it well, with the x-axis being the percent vaccinated and the y-axis is the year. So I'll give you guys maybe a minute or so to answer the question.
Oh, Willie is leading us by saying D.
Sorry?
No, we have 2 Ds already.
D.
Mm-hmm.
Okay.
D for dog. For dog. Yeah.
D for dog. Okay.
Mm-hmm. Oh wow. There's a B for boy, but
okay.
it's so far 6 Ds.
6 Bs?
6 dogs,
okay.
and 1 boy.
And 1 boy. Can one person, let's hear from the person who said B and the person who said D, just their thought process. Anybody, any of the people who chose D, just to expound on their thought process?
Rita, why did you choose D?
Now that's simple, easy, awesome. Switch to Xfinity today and get a great offer. Get advanced security for free when you get the X5 gateway. $72 value per year. Go to xfinity.com, call 1-800-XFINITY.
Can you hear me?
Or visit an Xfinity store.
Yeah, just speak a little more closer to the microphone.
Can you hear me now?
Yeah.
Yes.
I chose D because incidence, as you said, is no new cases. So if the vaccine is effective, that means people won't be infected. So the incidence will fall because there'll be no new cases. That's why I think D is correct.
Okay. What about the person who picked B?
Julie? Okay, so she said her audio is not working. She chose B because the number of people dying would reduce in 2012 compared to 2010.
Okay. So the correct answer here is actually the incidence, just as Rita has explained. And again, because vaccination, you know, when you think about vaccination, what are we preventing with vaccination? Because we give vaccines not to people who already have disease. We give vaccines people who don't have the disease so that they don't acquire the disease. If you're thinking about measles, for example, measles vaccine is to prevent children from acquiring measles. And when we just, from the previous slides, we're talking about incidence, looking at the new cases. So if you give a vaccine, then technically you're keeping people outside of the at-risk pool, so they are not likely to acquire the disease. And I hope that makes sense. So you're going to affect the incidence. Okay, let's move on. Can you see that one clearly?
I can. And guys, I'm enabling people's microphones, so you can always try. Remember to just mute if you're not speaking.
Okay. So a researcher develops a new assay to diagnose HIV. He believes that his lab test is superior to current ELISA and Western blotting techniques and wishes to use the test in a sample population. The assay quantitatively measures HIV-specific proteins in patient serum. The researcher chooses point A as the threshold for a positive test, and you can see that diagram there. So which of the following is most likely to occur if the threshold is moved from A to B? So we've moved on. I think we've done like the incidence, prevalence, a few questions on that. So I think I've moved on to sensitivity, specificity. So I'll give you guys a minute and a half to answer the question.
Already have stress by looking at this question. So we so we have a couple of boys and dogs, but more boys.
More B's than and D's.
Yes, there's also a C.
There's also a C. So B, C, and D. I kind of like, like when people explain themselves, it kind of makes sense to know what they're thinking is.
Doreen, tell us why you chose B.
Honestly, I took a guess. I'm not sure.
Let's see who else. Anyone else who chose B, just pick.
I chose B.
Okay, why did you choose B?
On the sensitivity and specificity, according to my understanding, you look at the probability of the, not probability, sorry, but the true positives, true negatives, and the false positive and the false negative. With the right side, when we go more to the right, it means that the positive is more like, more of this positive is on the thingy that goes, the midpoint thingy, meaning that
like from A more to, okay.
A more to the, it's going to the other side, to the right side, to the left side rather, you get like, there's more sensitivity, increase in sensitivity. And if you're going from A to the left side, A to the right side, it means that there's increased specificity. So this one, B is on the left side of A, so it means that there's increased specificity, sensitivity, meaning there's more true positives and there's less false negative when you see in that curve. I don't know.
Thank you for sharing. What about those, anybody who picked C and what their thinking was?
Grace, you picked C. I think we have some shy participants.
Okay.
Anyway.
It's okay. The right answer is actually as I don't know who was explaining. I couldn't quite see their name. Whoever who explained her answer as B. So the correct answer is increased sensitivity and decreased specificity, which is B for boy. So most of you got that correct. And I just added a slide here just to try and clarify what she was saying. Here you have, from this question, you have your true positives here and true negatives on this other side, just as she explained. And so moving your point for this dotted line, if you move it more to the left, if you look at this tiny box here, which says the false negatives, you're reducing the false negatives, okay? So you're increasing your sensitivity. Okay, if you were to move the other side, then you're decreasing your false positives, so you'll be improving on the specificity, sorry. So moving the dotted line from A to B decreases the number of false negatives while increasing the number of false positives. So you increase sensitivity, but specificity decreases.
Doc, do you want to explain what sensitivity and specificity is using maybe like an example, like for a test?
So I put
Maybe
another slide here.
Oh, okay, yeah.
Which typically, I talked about 2x2 tables. And so mastering the art of 2x2s is really the, I think for sensitivity, specificity, and the positive predictive value, negative predictive value, mastering these 2x2 tables is what is helpful for step one, for biostats in general. And most of the time, of course, nobody is going to design this table as it looks here for you. So you have to be ready to just quickly form your own, when they give you the question, form your own table. Here, you usually have the test results on the x-axis, if I may call it the x-axis, on the x place here. And the top here is usually the truth. So for example, if you're looking at the gold standard, it would be the truth at the top here. And the test that you're trying to assess sensitivity, specificity will be on this side. I hope you can see my cursor where I'm pointing at. So yes. The positives will be here and the negative. And then this will be the people, because your gold standard is, you're trusting that it's telling you the truth. So people who have the disease fall in the first column, and then those who do not have the disease in the next one here. And so people who fall in this first quadrant here, okay, your test identified them correctly that they have the disease, okay? And then people who fall here, they have the disease, but the test failed to detect that. So it's a false negative. And then if you move here, these people do not have the disease, but somehow the test has identified them as having the disease. So false, positive, and then of course here the true negatives. And you can see if you increase, if you're looking at the sensitivity, which is, the formula is you're looking at those who truly have the disease, divide by, so those who test positive divide by those who truly have the disease. So TP, true positives, and false negative here form the denominator. Okay, so true positives over true positives plus false negative. So you can see the relationship here is that if you increase the true positives, you decrease the false negatives, you're improving sensitivity. When you move to specificity, you're looking at the true negatives over this total, okay? So if you increase the true negatives, decrease the false positives, then you're increasing specificity. And the reverse is true. If you have more false positive, then your specificity will go down, okay?
Super, super high yield. It doesn't matter, even step 3 has these things. You have to understand this table, right? So when they say the COVID test, should it be sensitive or should it be specific for helping the population? I don't have the right answer.
So in most cases, you want a sensitive test, right? You want to really reduce the false negatives because, in some cases, they'll ask questions like maybe, what do you want to start with first, okay? But truly, most of the times you'd want to have a test that is sensitive to reduce the number of false negatives. So questions?
Okay, people are saying it's clear.
Okay, let's go on to the next. Okay, in a medical class of 147 students, the distribution of scores on a biochemistry final examination has a mean equal to 67, a median equal to 76, a mode equal to 80, standard deviation of 5.5, and a variance of 30.25. 3 students were unable to take their test on the scheduled date and were given a different form of the exam 1 week later. Which parameter is most likely to be, let me move this here, to be the least biased estimator of central tendency for this distribution of biochemistry test scores? And this one, I think, is one of the easier ones, so I'm almost sure everybody is answering chat box.
So As people answer, there's a comment from Sheila. If treatment is toxic, the test should be sensitive or specific.
Sorry, if
the treatment is toxic.
If the treatment is toxic, oh, that's a good question. If the treatment is toxic, even more reason, I've never thought about it that angle, but even more reason then that you don't want to have false negatives, because you don't want to subject somebody to, for example, chemotherapy when they don't have cancer. So you need a highly sensitive test to identify the true positives. Or maybe it was a comment, which I agree, yes. If you have a toxic treatment, the more reason you need to have a sensitive test. Any answers on this question?
Yes, we have ACCA. And Sheila clarified that was a question.
Oh,
the one you answered, yeah.
okay.
So we don't have too much. Yeah, we have 2 A's and 2 C's, 3 A's, 2 C's, and C and A.
Oh, okay. C and A.
So I would say that it's, unless more people have answered right now, that the bias is leaning towards A.
Okay. So I guess maybe then I don't know, my thinking was that this is gonna be an easy question, but the answer is actually B, which is the median. Okay. And the reason being, this is why I wish I had like a whiteboard to kind of write and put out my thinking, but just think about the mean. The mean is the average, okay? So if you have an average of like, let's just give an example of like 5 students. You have 5 students who, do the test. One scores 0, and then maybe the other 4 all score above 80. What does that do to your average? It kind of brings your average down, right? So that one person who got 0 or like 10% kind of brings the average down, even though you have 4 people who did really well. So in that case, then you find that when you have like extremes, people who did really well, people who did poorly, the average tends to not be a good measure of central tendency. And then the mode will tend to pick the, the most where most people lie, okay? So again, if you're to give an extreme example, if you have 100 students, and then maybe let's say 10 students, you have 10 students, majority of them actually score below 50. I mean, not majority, you have like 4 or 5 people who score below 50, but then maybe 6 of them are like above 80, okay? The mode will be 80, but then you've left out a few people who scored like lower scores. So the median, and I wish I had diagram, I wish I had put a diagram. I assumed this one would be an easier one, so I didn't put any further explanation, but the median tends to be a more reliable measure of central tendency because it's less affected by this kind of extremes, unlike the mean and the mode.
There's a question, actually. Could you clarify what you mean by biased estimator?
So the bias comes in, for example, like when it's a mean because to achieve the mean, for example, if there are 5 people and 4 of them get, for example, 80%, so that it's roughly, and 1 person gets 0%, the average there will come to like 80 plus 0 or 80 plus 10, for example, which is 90 divided by the number of students, or divided by 2. Okay. How do I put this? I feel like I'm confusing people some more. So let's say we have 5 students.
Doc, you could pull up a Word document, or you can use annotation. which would still allow you to write, not draw very well. But you can pull up a Word document or something.
Actually, there's here.
Like draw, yeah, but sometimes it doesn't work very well. But what to do?
I wish I had like a pointer. Oof. Anyway, but the gist of it, I guess, is I don't know if this makes sense, but if you have like 5 students, for example, student 1, let me try to talk this out. Student 1 has 10%. Student 2 has 70. Student 3 has 70. Student 4 has 70. Let me make it simple. Okay, to get the mean, then you're going to add 10 plus 70 plus 70 plus 70, which is 220, right? Divide by 4. Okay, so this person who got 10%, because they're on this lower extreme, they brought down the average quite a bit. Okay. If you were to pick the mode for this same example, you'd go with 70 because majority of the people got 70%. Okay, but if you had one extreme person who had like maybe a few people who had 100%, then you would go extreme and forget the people who had 70 and 10%. Okay, but if you were to go with the median would bring you right in the middle, which would be roughly around 70%, which is a better estimator of the central tendency. So the median is less affected by extreme numbers, if that makes sense.
I guess no more concerns. People saying they got it.
Yeah, I will. Yeah, maybe if somebody is having any more questions, just reach out to me. I'll give you my email at the end, and you can reach out to me for more questions, and I can clarify.
Okay.
Okay, so we'll move on to this question because I see also our time. I didn't realize it's already 8 o'clock. Okay.
Don't worry about time.
Yeah. So we have
this is super important as long as you're able to.
Sure. Sure.
Usually, I'm very proactive about when to end the call, but this is so important. Even I cannot give this lecture, so.
So a large study of serum cholesterol levels in patients with diabetes reveals that the parameter is normally distributed with a mean of 230 and a deviation of 10. According to these results, 95% of serum cholesterol observations in these patients lie between which of the following limits?
All right, guys, let's be proactive so we can go through all the questions. I see a D, A.
Sorry, which one?
Dog, apple.
Mm-hmm.
We have 3 C's. We have E. Well, this is probably the most widespread case, but I would say that, I mean, it's all over the place. All of them are being answered. So, guys,
This message comes from NPR sponsor.
Let's hear from Arthur. Why did you choose A?
From Wi-Fi threats. Xfinity X. It's connected.
You should be able to unmute and just speak.
Okay, remember right? So they're asking for, they're saying 95% of the observation. Remember right? It's within one standard deviation. If it's within one standard deviation, so the 30 minus 10 on the lower side, and the higher side to 40. That was my reasoning.
Okay. Duncan Degwa, what did you do?
I changed my answer from D to C.
Okay.
I chose the wrong one.
Okay, why did you choose C?
I chose C because two standard deviations covers 95%. 3 is the one that covers 99%. So that's why I changed from D2.
Okay. And welcome back, Walter. Brian, do you want to talk about B, and then Dr. Masese can maybe wrap this up? Okay, maybe he cannot unmute himself.
Okay, I think, is it Duncan? Duncan who said C, and anybody who picked C, you're correct. So it's this, this is part of the statistic. When you have a normal distribution, a normal model, you have this 68, 95, 99.7 rule, which states that, when you have a normal distribution, then about 68% of the values lie within one standard deviation, okay, on either side. So if in the middle here, when you have a normal distribution, where I hope you can see my cursor here, my pointer.
Yes.
This middle here, the mean, median, mode all lie on this line. So the mean is here. So 68% of the values will lie within one standard distribution, which is positive this way and negative negative this way and positive this way. So this yellow is our 68% within one standard deviation. And then 2 standard deviations is 95%, and then 3 standard deviations is 99.7. Okay, so going back to our questions, I think the mean was 230, so our number 230 would be here. So 2 standard deviations, 95% would cover 2 standard deviations. So you'll be going 2 this way, so that will be, and since the standard deviation was 10, so you're beginning at 230 to 240 to 250 here. And on the lower side, you're going from 230 to 220 to 210. So making that the answer to that question, if I go back here, C is the correct answer. And I think, Arthur, I guess you just missed it, that the 95% covers 2 and not 1 standard deviation. If it had been 1 standard deviation, then we'd be talking about 220 here and 240 here. Okay?
Thank you.
So now that I've explained that, let's see how clear that concept was, because this question is also related. So the same question, but now we are asking what value corresponds to the 97 percentile of serum cholesterol level. What value in these answers here corresponds to that? It's 255. Okay.
So we have E, B, E, E, A. Okay, lots of E's. Okay,
sorry, lots of E.
Yeah, lots of E's. Let's hear from Irene Kaptingay. Why did you choose E?
Um, 97.5 is more than 95. So 95 to 99 is the third or 3, above 3. So I said maybe in those answers, it's either 200 or 260. So the closest to that is 200. So that's what I chose.
Awesome.
Anybody else want to?
Dr. Amade, why did you choose B? And then Walter Mogeni, why did you choose A? We have to welcome him back.
Yeah, I think that's awesome. Perfect. Walter will give us his explanation too.
Oh, yeah. So I'm a psychiatrist. I'm allowed to get it wrong. So
Don't worry, I've also been getting them wrong.
So I think I'm participating because I can fail to encourage everybody to participate. I think the most correct answer for me looks like either A or E. A tends to be at 95 percentile, but according to Irene's explanation, I think I'm almost changing to E. So I'm not sure. You can go ahead and explain that.
Don't follow the hard. Just go with your answer.
Yeah, that's what I was thinking. Like 95 percentile should be, because you said true standard deviation.
Actually, the question says 97.5 percentile. Okay.
Yeah, so it should be more than 250 at least.
So if I go back to this diagram, okay, the way to think about it is, like this is like a one-sided question. Here we are not asking you what is falling within 90, what falls within, we are looking at what is the percentile. So to get the 95th percentile, remember this middle line here, we are at 50%, right? Then one standard deviation, if we move here, if I ask you what is the 84th percentile, you'll be at this line. So one standard deviation above, okay?
Okay.
What happens when you add the next 13.5? What number do you get? 84 plus?
Yep. Plus
13.5 comes to what?
Oh man, I need to add.
That's 97.5.
That's 97.5.
Oh.
So the 97th percentile is here at 250. So the value is 250. So Mogeni, you are right. I hope you didn't want to
change my mind again.
You don't bring your mind back to the correct answer. And I don't know whether people follow that question, because that's the tricky part about how they ask this question. Okay. So the 97.5 percentile is actually here, 2 standard deviation above. So it would be 250. Okay. And so if they ask the question in a different way, how many, sometimes they can ask you how many people fall within, like how many people have below 250, okay? A reading of 250 and below, then that would be 97.5% of the population.
Okay.
Make sense, people?
Oh yeah, there are lots of yes on the chart, and nice. And Walter, today we're trying out where I unmuted. Oh no, someone said please repeat the explanation.
Okay.
Sorry.
Got it.
So again, sorry?
Arthur, do you want?
I finally understood the explanation. Thank you.
Okay.
Yeah.
So the question appears a lot in step 1, I think in different varieties. They'll try to trick you in different ways, but just learning these numbers and these percentiles, I think will be helpful. So I added one more just to be sure that we got it right. So the lifespan of meerkats in a particular zoo are normally distributed. So we have a Gaussian curve, like what we've just seen. The average meerkat lives 13.1 years. The standard deviation is 1.5 years. So use the empirical rule, 68, 95, 99.7% to estimate the probability of a meerkat living longer than 14.6 years. And I'll give you guys time to answer that.
Pauline, what do you want Doc to repeat?
The previous question that we just did, the place that she mentioned 84%, I was trying to figure out how she ended up later to 97.5.
Oh, okay.
Yeah.
Do you mind we finish this question, then I can go back for those who are already reading this one?
That's okay.
And Brian, I see you have a question on mode, but let's answer that at the end. Let's just keep on this for a while. Bernard, sorry. Okay, I can tell you that I don't see answers yet, guys. There's a C and dog. 2 dogs, 1 cat.
So there's a C and a D.
Yes, there's a
Yes.
C, D, and a B.
There's a C and a B. So the person who said B, I don't know if people mind, but I feel like it's nice to explain your thought process, because then you know, I guess it helps to see whether your thinking was clear or not, but also we're running out of time, I guess.
No, so Willie Modoy, tell us why you chose B. Guys, don't feel bad that I'm calling on people. I think this is not actually a bad format.
We're all learning.
This this is also friends. You know that I've been saying my wrong things too. So we'll hear from Willie if you're able to unmute, and then Duncan why you chose C.
I think from the example, the standard deviation is 1.5 years. So the probability of a meerkat living longer than 14.6, that is exactly positive 1 standard deviation. So from the graph, we have 0.15 plus 2.35 plus 13.5 plus 34 plus 34, which comes to 84.
Okay. What about Duncan, who said C?
I use the same principle, but in this case, a meerkat that lives to 16.1 years will be in the 84th percentile. So I just worked backwards. There's a 16%, 100 whereas at 84, there's a 16% chance that they'll reach that 84th percentile. But I'm not sure of that. The maths make sense in my head. I don't know how to explain it.
Yeah. So the correct answer is actually C, and I put B in there just to confuse folks, because you're looking at the person who said, like it's 1 standard deviation above. That is correct, and that 1 standard deviation above is, looking again. Somebody had asked about the explanation how we got 84%. So the midline here, if you're standing here at the mean, you're standing at 50%. Okay. If you add 1 standard deviation above, you're at 84%. Do you see that? It's 50 plus this 34% here. That's how we got 84%. Okay. If you are to add another standard deviation, then you come to 97.5%. Okay. So this question was asking about meerkats living 1 standard deviation longer, but they're asking longer, not less. So if a meerkat is to live longer than that, you're looking at this side of the graph. So if 1 standard deviation brings you to 84, the total is usually 100%. So you're looking at 100 minus 84, which is 16%. Makes sense?
That's a good question. I like it. It's super high yield for exams.
So I hope that makes sense, because they asked for living longer than 14.6. So it's the other side of the curve, not the less. So 84 would have been if how many get to live at least to 14.6 years would be at least 84%. But longer than that, it's whatever else is left on top of that, which would be the 16%.
Someone said kindly repeat. Sorry.
Okay. So let me go back to this graph that we were using. So this is like a normal distribution curve where the mean, median, and the mode all fall at the same point. At this midpoint here, when you're looking at the mean, half of the people are below the mean, which is 50% this side, 50% to the upside. Okay, so you are right at the middle. Okay, if you were to go one standard deviation above the mean, since 68% fall within one standard deviation, when you split that evenly, it's 34% on either side. So if you were to go lower, because the question could have gone lower, you know, like how many meerkats get to live, for example, 13.1 minus 1.5. That would have been one standard deviation below. So that would have been 50 minus 34, okay? You come to this side, okay? Which would have been, again, the same thing because it would have been 16% this way. But they were asking how many get to live 1.5 years long, get to live 14.6, which is one standard deviation above the mean. So that puts you at 50, which is the midline. Add 34% comes to 84, okay? So 84% of the population will get to 14.6, but the ones who live longer will be 16%, which is 100 minus 84.
A couple of people say they got it.
Okay.
Yeah, guys, we're gonna take, like I said earlier, we're gonna try and keep going to allow Doc to finish this topic. I really do not, you must agree this is probably one of the best topics ever. And so I don't want to, this is high yield stuff, very high. So Irene, you have your hand up. You wanna say something?
Yes.
Okay.
I have a question. How did you know it's one standard deviation, like it's one? That's hard because...
Oh, this one here, because this is the trick again. 14.6, if you look at 14.6 here, they didn't do the math for you. 13.1 plus 1.5 is 14.6. Do you see that?
Yeah,
so
yeah, okay.
And they gave you the standard deviation, okay?
Okay.
Okay.
Thanks.
I think we're in the clear.
Okay.
No, but if you don't understand anything, you can ask again, but we can move on to the next question.
So we have another quick question here. An investigator suspects that acetaminophen used during first trimester of pregnancy can cause neural tube defects, and she estimates the risk of neural tube defects in the general population as 1 in 1,000. Which of the following is the best study designed to investigate the hypothesis?
Okay, so we have A's, more A's. Let me see someone who's not spoken. Joy, why did you choose A? It's mainly A's and one B.
I felt this was a little bit tricky because study designs are like more or less straightforward, and maybe you'll see with the next slides. But in this case, the answer is actually B. You want to go with a case control study. I don't think I put too many slides to discuss like study designs per se, but one of the things that help you qualify like which study to design to use is how rare or how prevalent a condition is. And so for something that is rare, if you design a cohort study, which is what most people did, you know, you're looking at a lifetime of accumulating cases, okay? And so you need a longer study, you need more money, it's gonna be more expensive. So an easier way to do some of those studies is to look at, is to do a case control study where you identify people who have neurotube defects and then look backwards and say, out of those people who, you know, got neurotube defects, I mean, you get people who have neurotube defects, those who don't have neurotube defects, and then look backwards and see who was exposed to acetaminophen. Okay, let's do the next question and let's see if the next few questions and see if this concept makes sense. The officials at a large community hospital report an increased incidence of ALL among children aged 5 to 12. They point out that some households in the community are exposed to chemical waste from a nearby factory. They believe that chemical waste causes leukemia. If a study is designed to evaluate the hospital officials' claim, which of the following subjects are most likely to comprise the control group?
We have nothing yet. Guys, are you tired? We can also come again for round 2.
Yeah, I mean, it's been one and a half hours. We can, because I still have quite a number of questions actually.
Yeah, why don't we do that actually? So we're gonna answer this as our last question. I have a couple of A, C, B, 2 B's, 2 boys. There's a D. Rita, you wanna explain why you chose D? A couple of D's coming.
I honestly don't know the answer, but I chose D.
Anyone else wants to explain the answer they chose and why they chose it? Pauline?
I chose D because you're looking at the cases is ALL and the exposure is chemical waste. So you want to look at population, you want to match against children who do not have the exposure that you're trying to relate to the ALL. So I thought between B and D, then I went for D. So I would have thought maybe if there was an answer that says children not exposed to chemical waste regardless of the disease, maybe I think that's what I would have chosen as the answer. But I will learn from this time.
Awesome, one more.
Yeah, so I guess also interesting to see, you know, like sometimes I look at this question, I can see how they can be confusing. The answer is actually C, children from the hospital outpatient clinic who do not suffer from ALL, because you are looking at the way this question is asked, you're probably looking at a case control study. So you already have the cases, and the cases are people who have the disease. So you're looking at people who do not have the disease as your controls, okay? And I'm just realizing actually what I will do maybe for the next discussion is have a few more slides to explain like study designs as well as mean median mode, because I think I probably underestimated how confusing they can be.
Yeah. Plus, I think you might need to add something to do with negative skew and positive skews.
Yeah, yep. I think I'll do that if that's okay with everybody. Maybe just add a few more slides on study designs and a few more examples, how we come up with the study design, and then we can also look at mean, median, and mode next time. Makes sense.
Okay.
Okay, some final words for Dr. Masese, and thank you. This was tough. Judy would not be teaching you this way, so we should be very grateful that she will work with her and see when she's available, and we can have the follow-up class. So it's gonna depend on her
And
availability.
actually, I don't know. I don't know whether I'm be able to share